Hi, I'm Dr. Kurt Woeller. I want to talk about small intestinal bacterial overgrowth and autism. Now, small intestine bacterial overgrowth, also called SIBO, is a significant problem for many people. Basically, what happens is we get an overgrowth of bacteria in the small intestine in places where it's normally not found. Many of these are large intestine bacteria that find their way into the small intestine. And that creates problems in digestion, absorption, and assimilation of nutrients in the small intestine. The small intestine is what helps is the main area where we're obviously absorbing nutrients into our body. It's also a major area of immune activity for our digestive system. Now, there's a lot of reasons that small intestinal bacterial overgrowth can occur. In adults, a major trigger is proton pump inhibitors or acid blockers. An infection of some sort that creates problems within the small bowel can also be a trigger. Diabetes or other types of neurological problems that lead to inactivity of the nervous system within the small intestine can be a factor as well. We know that gut problems are a major comorbid problem in autism. We know that dysfunction in the small bowel can also occur. But just because a child has bloating or gas or loose stools doesn't automatically mean they have SIBO. They might just have a large intestine imbalance. Now, the difficulty with SIBO is testing. Doing SIBO testing in a child is difficult, particularly the methane and hydrogen breath tests. So it's a challenge because they'd have to collect a breath sample, every 15 minutes for a number of hours. It's not easy to do. We can get some idea of SIBO off of an organic acid test. Although the organic acid test is not going to be diagnostic of SIBO, it will certainly indicate bacterial dysbiosis, and then putting that together with the clinical picture will get us close to sort of strongly suggesting that SIBO is occurring. Now, when it comes to SIBO intervention, it's not just about taking an antibiotic or taking a botanical to kill off bacteria in the small intestine. It's important to understand that the function of the small intestine is dependent on other aspects of digestion. What's happening in the stomach, pancreatic function, liver function, bile acid production, all have a coordinated role in what's happening in the small bowel, which then leads into the large intestine. So it's a comprehensive approach, but it can occur. One of the things that I'm a big advocate of when it comes to just gut problems in general, in anybody with autism, whether it's a child, teenager, or adult, is the organic acid test. My preferred organic acid test comes from Great Plains Laboratory because I feel that it's the most comprehensive test there is, and you get specific markers on that test that other companies don't have, particularly things related to mold exposure, as well as Clostridia bacteria. So for me, when it comes to biomedical testing, and anybody either with documented SIBO or a suspicion of SIBO, an organic acid test is always on the list of things to do. I'm Dr. Kurt Woeller. Thank you.